Now let us move towards the panel video discussions, eagerly awaiting to see the videos and do the insights and these insights will be done by the best of those industries. So we have chosen very diligently which panel member will be there in which panel discussion. We will, first of all, I will like to thank my team, the video creators and the patients for the hard work, patients for giving us permission to, share their journey. Some of the patients have also said, no, we will like to be in front and do not mask anything. So thank you for that. Some patients have asked for masking, some have not even started the video, but shared their journey. Thank you to all those people who shared their journey of disease with us. I will especially thank, first of all, my intern team and my team and all those who have created videos, helped us create videos. From my team, Vivek sir was there, Zena, Gauravi, Shazia, they all did fabulous work of creating. Sushma did the editing, and Dr. Satish was there behind all of this. And then we have the team of young interns from Narsi Monji and Jamia Hamdard, Trishank Gupta, Pranav Gupta, Dhruv Gupta, Dhruvi Thakkar, Manish Sardana, Paritosh Srivastava, Shreyoshi Groshal, Priyamvada Mathur, and Sharaban Tohara from Bangladesh, Debashish Mondal, Dr. Nusrat, and Mr. Hasin Jabbar. Really thank them for getting us these videos. The panel discussions will start from now, and I have one more person to help me today, co-host and moderator, Zena. Zena is has a rich and varied experience of 25 plus years in sales, marketing, and business strategy across pharmaceutical companies, domain knowledge of various therapies, both in acute, subchronic, and chronic segments. Co-author of the book, What Does the 21st Century Pharma CEO Want from the Brand Manager? It's a book for all Greenhorn Pharma brand managers. Currently an educator, trainer, and a writer. Welcome, Zena.
Thank you, Swati, for that wonderful introduction.
And now let us move towards the diabetes panel. I'll quickly introduce the panel we have with us today, and then we will move towards showing you the videos. So we have Dr. Ashok Bhattacharya, industry veteran with over 40 years of experience in global pharmaceutical MNC in leadership and managerial roles. He served on Takeda Asia Pacific leadership team and earlier on executive management team and Merck Serono leadership team. He's a member of Leadership Excellence, Harvard Business Square. Welcome, Ashok sir.
Thank you, Swati.
Thank you, sir. And then we have Mr. Shashin Bodawala, ex-director, Business Excellence, Go-to-Market and International Business at BI. He had an 11-year stint there, and earlier he was with Pfizer with an 18-year stint there. He talks about go-to-market, digital health, digital channels, digital transformation, and has built and developed profitable businesses from scratch and launched some of the largest brands in the market, which eventually created the fastest growing pharmaceutical company of India. Welcome, Shashin sir.
Thanks a lot, Dr. Swati.
And then we have Mr. Alhad Mahajani, Vice President Marketing, Juventus Healthcare Limited. He's a business strategist and marketing professional with a wealth of experience and proven track record of success in the Indian pharmaceutical industry. With a career spanning over 25 years, he has been a key player in the growth and development of some of the most well-known names in the industry. Not to be forgotten, he is doing his PhD on the subject of patient centricity, and we had a wonderful talk 2 days back when he joined the Bangladesh panel discussion also. Welcome, Mr. Alhad. Let's move towards watching the videos. Please be patient with us. There are 2 videos, 1 minute. We have tried to edit out some parts of the videos because they are long videos. The panelists have been sent the raw videos, so they have the insights with them. And the first video would be around 12 minutes. Second video would be around 9 minutes. We will try to look at them and then start the question answers to the panelist.
What are the experiences? What are you having?
I know I have diabetes and I take medications and I walk as, whenever my wife shouts at me. So basically that.
Does diabetes run in your family, or you're having diabetes because of some other reason, like stress at your workplace or eating habits?
No, it run in the family, but mine started with the stress. There were certain situations in 2018 where I was very much stressed, and I guess that's when it happened.
At that time, did you panic? Tell us what exactly you did at that time.
Frankly, when I found out I have got diabetes, that's who I am. If I have it, I have it. I have to deal with it. So no sense panicking about it. Half of my friends are like a medical profession or something or other. So I asked them, and they said, okay, those two, you have to walk a lot and you have to stop eating sweets. That's it. I've been taking less sweets. But then again, you just cannot hold your tongue. So once in a while, I do take.
Also, if at any time after taking the medication for diabetes or insulin injection, do you feel dizzy or giddy, your hands were shaking, had tremors, or they were suddenly sweating?
No, Sazia, nothing like that. Look, let me tell you about my diabetes. When I found it in 2018, it was as high as on empty stomach about 14 some days. I'm very, not at all much informed about this medical thing and our human body. So 14 is okay. Ye kya hai 14? Then I looked it up and then I said, okay, it's bad. And 20, I started taking medication, but never felt dizziness, vomiting, sweaty hands, nothing like that. And then now it's on empty stomach. Some days it's 5, some days it's 7, rarely it's 4, usually even on empty stomach 6 and 7. And I'm really okay with that. I do not have any kind of physical stress or uneasiness, at least not me.
Do you follow the doctor's instruction for exercise and diet regimen?
Diet, yes, because I've been, how do I say, I've been enlightened by my wife that because I take metformin, so my hunger is less, but I kind of feel hungry every 2, 3, 4 hours, 2 and 2.5 parathas in the morning. Now it's an effort to finish one. So that's one minus, I think. I cannot enjoy food that much. Yes, and I do, like, coming back to your question, yes, I do walk. I've been told to do it 4 to 5 times, but I end up doing 2 to 3 times max. That's for half an hour on the treadmill. And I do it at my own leisurely pace. I don't rush it. And I don't take, our usual mithai and all that as much as I'd love to. And I do not take raw sugar. I use sweetener in the coffee sometimes. And I kind of been forcefully staying away from sweets, as much as possible. But it's not that I don't take it. I do. Chocolate, somebody brings it from abroad.
What gives you hope and motivation on the days when living with diabetes feels especially very difficult for you?
No difficulty as yet, trust me.
So, since you have told me that you are a sweet tooth and you have shared some of the stories as well, can you tell us about your feelings during festivals when family members eat sweets and you are stopped from having sweets?
Yeah, I look at it, I want to, then I think that, nahi yaar, ye to acha hi hai, nahi khana chahiye. So I kind of resist myself. But once in a while, I do give and pick up 1 piece or 2 pieces,
Speaking of family, how did your near or dear ones feel at that time? Did they panic?
I'm the youngest in the family, so already all of them has experienced at some point in time. So there nobody panic, just as usual, when you have in this part of the world we are very family needed. So especially my sisters, nahi khana chahiye, you don't do this, watch yourself, umar kam hai, and you are already got diabetes and vagara vagara. So I said, "Arey yaar, chodo."
Can you share how the pharma industry can be of help to patients or caregivers?
Create some kind of wonder drug. Seriously, jokes aside, that you take one pill a week or something like that, instead of one in the morning, one in the afternoon, or half in the night, on all that kind of crap, because you're a working lady. In life, when we are really working people, it sometimes is not possible to have it just before lunch, half an hour before lunch, because the doctor said so. Uh, you know, so these kind of things, if they can improve on it, wonder drug once a week, or just one tablet in the morning, uh, because mostly our life, I don't know, but mostly our life has been, when it is work, it doesn't end at 6. It carries on sometime. We have got, commercial visitors and other things. You have to go out for dinner, take them around and whatever. So it gets difficult, at least for me and the people I know, that to just have another pill at 8:30 in the night before dinner, because dinner not necessarily is at 8:30. So the pharma industry needs to come up with some kind of wonder drug, something. We have been to the moon in 1969, and this is 2023. What are we doing all these years? The awareness is not there. The pharma industry really need to come up with, like in Facebook, we see all kind of crap all day long, but there should be sponsored information about diabetes, like this is the pluses, these are the minuses, this is how you need to take care of yourself, and, enlighten us, teach us, help us go with the thing. Why do we have to end up with the doctor? Because Google is a wonder itself, so if it can be made more easy, accessible information that we can, really go about it, that would be helpful. I take one insulin. I take 0.5 mg once a week, and that's given to me by this very elderly doctor at Bumrungrad. So she ended like, mother hen shouting at me, "It is so high, it is 8, you should do this and you shouldn't do that." Okay, then she prescribed this medications, Metfor, Zardians, and another one, and this injection once a week. So state of mind, I think this insulin helps me. If I'm having a regular diet, not indulging myself with chocolates or sweets or anything, empty stomach, I get between, frankly, 6 and 7.5, which is high, I presume, but I'm happy with it because I was at 14. So, I've done great. And somewhere in my head, I feel that this insulin helps. And this insulin is not, it's selling in Bangladesh, produced locally by local company. Some doctors prescribe it. So once I got it at Bumrungrad, my wife and I went to see this doctor, and and she said, yeah, this is good one. I'm glad she gave it to you. So I was kind of, it was on the company who makes it, I don't know how it works in your industry, but they need to give an ad which says It could be said as a wonder drug, take it, feel good. So more for the common people, there should be more information. You see, the economic condition of the world is in a mess. So the family people, the common people, we feel stressed, and that's gonna give us diabetes. So there is nothing we can do about it, except the farmer people need to come up with something fast, something good. Like I said, some kind of wonder drug which will cost us less money to buy, but will give us more relief instead of a daily thing, weekly stuff.
Is there anything else you wanted to share with us?
More advertisement, awareness. That's it, and make it easy for people. Make it simple. Make it, layman to understand that if it's okay if you miss your pill in the morning, it's still okay, but you need to carry on and face it, and not scare people. Oh my God, you got diabetes. You have to be careful. No, you have it. Face it. Live with it. Work on it.
क्या तकलीफ था आंटी आपको?
मेरे पहले पेट में दर्द हुआ, फिर मेरे को डॉक्टर के जाना पड़ा, फिर 2 दिन एडमिट रही तो फिर बोला कि शुगर है।
कितने साल पहले आंटी पता चला शुगर है?
ये मेरे को 10 साल हो गए थे, उसके बाद नहीं, पहले ही।
आज से 10 साल पहले?
हाँ, आज से 10 साल पहले पता पड़ा था कि शुगर है।
शुगर है, तो उसी समय आपकी दवाई शुरू हो गई थी शुगर की?
हाँ, फिर तो दवाई शुरू हो गई थी मेरे।
और फिर क्या हुआ आंटी?
फिर वैसे लेती रही, फायदा नहीं पड़ा, फिर डॉक्टर दवाई बदल दिया।
दवाई बदल दिया?
हाँ,
फायदा ना होने की वजह
फायदा
से?
नहीं होने की वजह से फिर दवाई बदल दी उसने।
तो जो आपको पहली बार पेट दर्द हुआ था उसके बाद डायबिटीज़ की वजह से कोई और तकलीफ हुई थी?
उसके बाद तो नहीं हुई, फिर वो दवाई चालू कर दी थी डॉक्टर ने,
तो कंट्रोल में था?
कंट्रोल में हो गया था।
अच्छा, फिर उसके बाद फिर आप क्या बता रहे थे कि
फिर
दूसरी तकलीफ?
खाना खाती हूँ तो खाना हजम नहीं होता, वापस मुंह में से आ जाता है, फिर खाना खाती हूँ उसी की वजह से ये हुआ था मेरे को।
अच्छा, तो दवाई जो आप ले रहे हो वो इंसुलिन तो नहीं ले रहे हो, या फिर इंसुलिन ले रहे हो?
हाँ, वो तो मेरे चलती रहेगी, दवाई तो चल ही रही है।
इंजेक्शन तो नहीं ले रहे हो?
नहीं, इंजेक्शन नहीं लगे।
अच्छा, अभी टैबलेट वगैरह ही ले रहे हो?
हाँ, टेबलेट ले रही हूँ।
अच्छा, ठीक है। तो दवाई लेने की वजह से आपको कोई कभी तकलीफ महसूस हुई?
कभी कभी होती है, वैसे पेट में दर्द होने लग जाता है।
तो रोज आप दवाई ले रहे हो या कभी कभी छूट जाती
नहीं
है?
नहीं, रोज लेती हूँ, वो डेली की दवाई
टाइम
है,
से?
रोज के टाइम पे ही।
सही है। तो इसी वजह से आपको लगता है कि कंट्रोल में अब?
हाँ, इसी वजह से मेरे को कंट्रोल में लगता है कि सही है मेरा।
तो कभी आपको डॉक्टर ने बताया आपको कुछ कि कुछ और अलग करने की ज़रूरत है?
नहीं, और तो कुछ नहीं बताया उसने,
बस दवाई चल रही है?
दवाई चालू।
आपने अलग से कुछ ट्राई करने की कोशिश करी हो, आयुर्वेदिक वगैरह?
नहीं नहीं, ये नहीं।
बस एलोपैथिक दवाई आपकी चल रही है 10
हाँ,
साल
वो
से?
चल रही है, 10 साल हो गए।
आप घुटनों में दर्द का कुछ बता
घुटनों
रहे
का
थे?
दर्द ये शुगर की वजह से ही रहता है ना।
कब पता लगा था घुटनों का दर्द?
ये तो बाद में पता लगा था, फिर
कितने साल हो गए तकरीबन?
2-3 साल बाद पता लगा था कि
तो इसके लिए आप वही शुगर की दवाई ही ले रहे हो या घुटनों के लिए अलग
नहीं,
कुछ?
मैं घुटनों की नहीं
इलाज?
ले रही, शुगर की ले रही हूँ, बीपी शुगर की ले रही हूँ।
घुटने का दर्द अभी भी रहता है?
वो रहता है अभी, तो फिर मैं दवाई नहीं लेती हूँ।
तो उसके लिए कुछ क्रीम लगाते हो, तेल लगाते हो?
नहीं नहीं, वो लगा लेती हूँ, क्रीम ही लगाती हूँ,
ट्यूब?
लगाती हूँ,
बस?
तेल लगा लेती हूँ, कभी मालिश कर लेती हूँ तेल की।
घुटनों का दर्द आपने डॉक्टर को बताया था?
बताया था उसने, ऑपरेशन बताया, पर मैं नहीं करा रही।
उन्होंने सीधा ऑपरेशन बता दिया?
हाँ, लेकिन मैं नहीं करा रही।
तो ये आपको कैसे पता चला कि ये डायबिटीज़ की वजह से घुटनों का दर्द है?
तो डॉक्टर नहीं बताई थी कि वैसे हो जाता है, तो
हो जाता है?
हाँ, इतना नहीं है, चल फिर तो लेती हूँ।
तो घुटनों के दर्द के लिए उन्होंने दवाई नहीं दी?
नहीं, मैं ही नहीं, उन्होंने दी नहीं, इतनी दवाई क्या करना है ना।
और ऑपरेशन बताया?
ऑपरेशन बता दिया, मैं नहीं करा रही। मैं वो तो बताता है मेरे को ऑपरेशन करा लो, मैं नहीं करा रही मैं
अच्छा,
ऐसे।
बाकी और कोई तकलीफ आंटी कुछ
और
कहना
तो
चाहते हो?
और कुछ नहीं है, और तो सही हो।
सही है। और आपको ऐसा लगता है कि जैसे जो दवाई आप ले रहे हो उसमें उसमें कुछ बेहतर किया जा सकता है जिससे आपकी तकलीफ कम हो जाए? आपके हिसाब से क्या किया जा सकता है ऐसा?
और दवाई तो यही चल रही है मेरी दवाई, तो और दूसरी है नहीं।
नहीं, इन्हीं दवाइयों में कुछ
हाँ,
ऐसा
इस
किया जा
फायदा है,
सकता है?
वैसे तो कंट्रोल में
फायदा
है।
है।
हाँ
तो आप संतुष्ट हो अपने इलाज से जो भी आपका चल रहा है डायबिटीज़ के लिए?
हाँ, वो सही है मेरे।
So my first question to you would be, a lot of patients have a very different reaction to, when they're diagnosed with an illness first to whatever point that they are in the illness. So could you tell us a little bit about how the journey has been for you, starting with the diagnosis up to now, and how you view diabetes?
It's diagnosed in the year 2018, May, June. I am a thyroid patient, hypothyroid patient. That is runs in the family. Out of 8 family members, 8 out of 4 are suffering from thyroid. Thyroid has got a lot of side effects. I found a lot of side effects rather than the diabetes, the more with the thyroid. And patient, those who are having a thyroid, hypothyroidism, lot of complications. When it comes to the 2018, when I diagnosed, it was the beginning before going for the doctor for the test and all. The initial, a lot of stress, strain, tiredness, anger, all these kind of symptoms. Generally, even hypothyroidism also was getting it. So I was not sure that it is because of the diabetes. So apart from that, my diet, I was not in the restriction, under the restriction of the diet. I was healthy, active. So life is functioning well, except the job stress. Then doctor advised me it is not coming down. Better you start using the metformin 500 milligram.
One small question, sir, is there anything that the pharma industry could be doing as such in order to improve patient outcomes or, help with better management of diabetes?
Medical society, what they will do, they are doing whatever the limitations that they have doing it. But only thing is awareness part.
So when it comes to the side effects or adverse effects that are associated with medication or certain problems that might arise during the administration, was this properly explained to you by the healthcare providers, the doctors and nurses, or is this something that you found out later?
Some doctors are feeling that, under the feeling of that you have neglected your life, you are facing that, you face it. I am going to treat. I am not a God. The reckless answers comes. I am not the God to tell you how it has happened, when it is going to. They should counsel the patient. They should have the counsel. And some of the patients, it is only specialists that I'm talking about. When it comes to the semi-urban, those even MBBS, RMPs are treating the diabetes. That's another biggest challenge. Patient who go with the sugar, when they found the sugar, immediately they initiate the pills without consulting, without recommending. Merely whenever they remember, they conduct some seminars. They make awareness themselves, not to the public. Even the government is not taking care. So 30%, 40% of the population is having a diabetes means they are also part of the government. To make the winning the government, they should also care. But even a diabetic patient also is not expressing this is the part of the government has to also take care. The diet is altered altogether. The foods which is supposed to eat only on the occasions, and it has become a regular. When it comes to the dietary chart, you ask somebody sitting over there, he will tell you how to eat. They will also in a rush, blah, 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 they said, and they send them out. It cannot be understand person who is affected diet. It has to be taken some time, ask for phone call, then make them all right and set. So that help the nation. Tomorrow, small children also should not affected with the diabetes because it is a generation together will have. That is only my suggestion.
We have shown you the three patient videos rather. We had to cut out because of time issues, some of the parts, but the insights will be with you, Ashok sir, Mr. Shashin and Mr. Alhad. I'll ask this first question to Ashok sir, related to, sir, can you please let the audience know what was surprising for you, surprising revelations during these interviews for you?
Yeah, thanks, Swati. First of all, let me wish the entire audience a very happy and prosperous New Year and a happy Makar Sankranti today. An auspicious day when we are having this panel discussion. Also, thanks to Pharma State Academy for adapting this route of patient centricity through the voice of the patient. Now, we saw 3 videos, yeah. And what is it that we got to know from, which we did not know perhaps, or which was something very startling? I think the first thing is all the 3, the common thread is roughly stress-induced diabetes. So it's more of stress which is leading to high glucose levels or diabetes. Number 2, I think we all feel as part of pharma organization, part of the healthcare system, that doctors spend perhaps time to explain the patient, to counsel the patient, either themselves or through dietitians or through diabetic health educators as such. Unfortunately, that doesn't happen, and which came up very candidly. That, for example, when the last video it was told about the side effects and all, and said, no, the doctor has never mentioned about it as such. The other thing which is there is we as healthcare, part of the healthcare system, we feel that we create lot of awareness. I mean, like what Sanjeev was also mentioning, that we create tons of leaflets, tons of videos, and all these things, and the camps and all. And we feel that we are doing a lot for patient centricity. We are addressing patient issues, or we are addressing issues for diabetes, or for that sake, any other disease. But what came out very rightly was, we might be doing a lot of activities, but that doesn't fulfill what the patient wants. So it lacks patient centricity. It's basically, we want to do what we want to do. We want to do what is right to do. We want to do what we feel that we should do. But we are not lending our ears to the patients and understand what is it that they want from us. And see the thread, all the 3, when you ask what should the pharma companies do, I mean, the one thing was a simple communication to them. That's what they are looking for. The other thing what the patient is looking for is, when say is the wonder drug, but what was also behind that wonder drug was the ease of administration, which is there. It should be cost effective. That is what the patient really looks for. And I think it was very interesting to listen to these patients and understand what we should really do in order to address address the needs of the disease area as such, and also how to improve the therapy, which will ensure proper health and bring smile to the patient's life and to the caregivers. The other thing which came also to light was that the patient's family is highly concerned. And therefore, if you look at the diet part of it is being taken care of when they are at home, perhaps. Outside, it's slightly difficult because somebody said, when my wife yells at me, you know. So that is something, it may be anyone in the family who might say. But at the same time, there is some restrictions, like when it was told that when the family is enjoying with sweets, what about you? So the patient also understands, no, if I can resist this temptation, it's good for me, it's good for my health. That is what the patient also understood. When it comes to exercise, that's totally up to the patient, his or her time. And that is where there is a lack of total exercise, adherence to exercise. So I think these are some of the things that we learn from these videos.
Thank you, Ashok. So, any additions to this, Mr. Shashin or Mr. Alhad? Because I see, like, is your spouse diabetic as a campaign after listening to them? So, Mr. Alhad or Shashin sir, would you like to add something to the answer?
So I think first and foremost, good morning, everybody, and wish you a very happy Makar Sankranti. I think it's a Sunday well spent. Learning, maybe not flying kites, but obviously flying your thoughts actually, and dealing with patient centricity, which is a great subject to deliberate upon. I would just like to add a few things which Dr. Ashok has actually is covered the topic completely well. I believe that a few comments which were there within those videos, like the frustration of the Bangladesh patient actually with the multiple doses. So while the organizations continue to spend money into finding out once a day regimens, when the doctors prescribe those regimens, they still make it complicated because half a pill in the morning or a pill, and that frustration was voiced actually. An insulin dose a week actually was almost like a blessing for him, and what came out actually was that typically is looking out for not only convenient medicines, but something like all cure actually of diabetes, where people have gone to the moon but not been able to find cure for diabetes. Okay, that is how he voiced it, and I think this is common actually. I've heard this, my own relatives and friends also asking when is the cure of diabetes going to come, and it's not unique to this patient alone. Okay, so these are two things which I saw, and the last patient actually talking about neither the doctor nor the pharmacist spending time is an opportunity which I see actually, which the pharma industry should really see and understand that this is one area which they can really work upon.
Thank you for adding, Sachin sir. Mr. Alhad, would you like to?
One thing which was very evident is that apart from the HCP, the patient carer or the patient family members probably have an equal or more say in medication and affecting the patient and his compliance to the therapy. That is what I could get. And therefore, probably, as Mr. Shashin said, the opportunity could also be influencing the patient carer along with the patient. So I think there is a gap area in terms of creating awareness for the patient carer as well. This was what was evident. Sister, brother, mama, mother, all this was evident. So this is an opportunity area probably.
Thank you. Zana, over to you for the next question.
Great. I'm happy that Mr. Alhad brought about this point of patient compliance and patient adherence to whatever has been prescribed to him. So here's the next question for you, Alhad. Some of these patients are apparently happy because they are adhering to the treatment. But data reveals, and I'm quoting the Capgemini report that we shared, that a good many number of patients, in fact, over 50% of patients on oral hypoglycemic medicines drop out. So what kind of patient-centered approach would you suggest, to ensure better adherence and compliance to doctors' prescriptions?
Yeah, Zana, that's a very nice question, because patient compliance and adherence comes out to be a very important issue. In fact, the other day when we were looking at patient adherence, the loss to the industry because of improper adherence or loss of adherence is to the tune of 528 billion Now that's a huge amount when it comes to the pharma market, right? And that's an opportunity for an industry to score a quick win. Basically, getting into the theory part of it, see, there could be three major areas why there is loss of adherence. One is the factors could be patient related. The factors could be, second could be factors could be clinician related, and third could be medication related. So there are three reasons why there could be loss of adherence. Now, when it comes to patient, the reason could be being forgetful. The patient could be in a denial mode, right? He says, I don't suffer from the disease, and if I don't take a medication, it's not going to affect me much. So he's in denial mode. Then there could be cultural kind of reasons as well as to why the patient does not take the medication. Right? Then when it comes to clinician oriented, probably as it came out from the video, that clinician has not explained the importance of the medication, and he does not know that by adhering to the medication, I'm already actually going to improve my life or my quality of life. So that understanding is not there. So that could be another reason. And then it could be medication related, as it was evident, the patient was looking for a wonder drug. Now, if there are side effects, if the patient does not know what kind of side effects are there, and he starts to get those side effects, he may not adhere to the therapy. So when it comes to patient-centered approach, probably there is no one magic bullet which is going to help, but definitely there are going to be some principles which are going to be very important to increase patient adherence. And now, looking at even classifying the patients, there could be 4 types of patients. One, those who are actives. That means, they believe that whatever has been prescribed to me, I have to take. So you don't have to really target them. The second category of patients are those who are information seekers. They want to learn about their medication and then try to abide by or adhere to their medication. The third kinds are, who are skeptics, who by influencing or, by coercing probably from the doctor's end or from the nurse end, they could, really adhere to the therapy. And fourth time are going to be, benigns who do not believe that medication is required for me. So when you classify those patients for a pharma industry, what is important is you need to classify those patients like those who are information seekers or those who are skeptics, and probably, look at developing a communication channel, because these are the kind of patients who are going to get influenced by what you're going to communicate to them. Right? Probably what comes out is that we need to classify these patients, and then we probably need to communicate to them. Right? So I would classify these steps of patient-centered approach would be understanding the root cause of non-adherence, right? Then looking at probably collaborate with various kind of stakeholders, in terms of developing a proper communication. This could be patient carers, this could be clinicians, this could be nurses. Then you have to look at maximizing the touch points to communicate what you need to communicate. Now here technology plays a very, very important role. It could be using gamification, it could be using in SMS, it could be using posters, information channels, right? This could be useful. You need to focus on right patients, so that for a pharma industry, what is also important is ROI. If you tend to focus on all those kinds of patients are not going to respond to you, then you are going to increase your costs and your effectivity is going to come down. You require to create patient experience. And finally, what is very, very important is you require to get patient feedback on a continuous basis. That is what is going to be very, very important as to which channels work, which channels do not work. So all this could be in summary trying to develop a patient-centered approach. Another important aspect is, not taking it too far, is going to be absolute right investment on kind of packaging which we need to do, so that patient adherence can go up. These were the few points which I thought I must share with you.
Really, really good points brought up, Mr. Alhad, and I hope somewhere pretty soon, sooner than later, there is some company which starts working on these, and I'm sure a lot of patients will definitely benefit if some of these are taken into action. Ashok sir, yeah. Mr. Shashin, anything that you would want to add to this answer?
Rather, Zena, I would rightly ask the question to Mr. Shashin here. When we are talking about drug adherence and compliance, like any company thinks of focusing their patient centricity campaign on drug adherence and compliance, it will always ask for ROIs, what is the increase in revenue. So what are your thoughts, how it helps if we focus on drug adherence and compliance?
So first and foremost, let me compliment Alhad. He has covered actually the entire aspects of patient adherence and compliance in a very lucid manner. So I'd like to put some data to it, and that would help maybe the marketeers who are here sitting actually listening, look at the size of the opportunity which is available. Okay, so the same Capgemini study talks about 50% adherence. Actually, the rest is not actually in the world. And this is developed markets like US and Europe and all, and possibly they believe that it would be significantly less in India or even developing countries. We have Indian data too, okay, and some of the studies done in Tamil Nadu or Uttarakhand and all put the data at around 43-44% or so. So first and foremost, that misconception that the adherence is extremely great in India is a misleading statement. Actually, I don't think that is correct. Okay. The Capgemini study also talks about the fact that there is, if you increase adherence per se, actually there is an increase sales possible of 36%. So that is the kind of quantum which the brand manager can look at in terms of working on this area. So now when the numbers are right, possibly going and selling it to a BU head and maybe asking him to make investments in patient adherence becomes a little more easy. Okay. Having said that, let me go back to what Sanjeev Navangul said in the morning, and I actually talk about trust. Actually, most of the patient adherence programs in India actually are not trusted per se actually by the stakeholders. And when I say stakeholders, I include the entire medical fraternity, whether it is the doctors, whether it is the chemists, whether it is the patients, or the even the relatives of the patients, and so on. Okay, there is a reason to believe that these are all very short-term and short-sighted approaches in terms of increasing sales rather than looking at the betterment of the patient per se. Okay, so when you're looking at patient education programs, patient benefit programs, or patient adherence programs, whatever you want to call it, actually first and foremost we need to go back and look at not only what is in it for the organization, but what is in it for the every single stakeholder, and not make it purely a discounting strategy or a strategy of selling more pills to patients actually. So this is the first area which we need to address together. You looked at various other examples, maybe what Dr. Sanjay Mitra talked about in the morning, and which is related to the Cipla asthma case, or even when you looked at the when you look at the insulin sellers like the Novo Nordisk or the Eli Lilly's of the world, and they are front runners in the way they use patient educators in terms of managing patient expectations. If you look at this Capgemini study again, actually they talk about the fact that the maximum impact which one can get out of investments in patient adherence is through patient education, actually, and patient educators or nurses being used most effectively. And this is the area where we as a industry don't score well, at least in India, and possibly not even well abroad, actually. India is an area where patient organizations do not exist, and possibly in the current world where even the content is created by the customer actually and the patient, it would be great to use this group to give voice to what we want them to actually voice out, and possibly address those quick wins the way they come across to us. Okay, the last one is actually which possibly Ashokji talked about in also, that there's so much of online communication, there is so much of focus on the kind of things which are made available to the HCPs, that this needs to possibly have a relook in terms of whether the investments are going awry or whether there's any great impact out of it. So these are areas which I believe is something which we need to look at. Now, where are the new areas which you can work on? Okay, and in India, actually, if you look at the huge volume of patient shift which is going towards the online pharmacies is one area which one can look at. The social media is an area where possibly, so digital is a space where one can really look at it in a big manner. The online pharmacies not only have patient data, but they can give you aggregated data of concomitant usage. They can you data in terms of the kind of side effects which the patients have. They can give you the data on adherence and compliance by the patients and so on. So one can actually aggregate the data and look at through maybe machine learning or AI technology, address even areas which you would like to quickly, because ROI will be a question mark, and you'll need to put resources only in places where patients are also patients are so keen on actually participating in such kind of initiatives also. So I believe that there are hosts of things which we can do. The industry can look out for ease of medication in terms of continuously focusing on more convenient pills, more convenient injections per se. The losing interest of the patient can be addressed by very many social media initiatives or digital initiatives also. Okay.
Yeah, thank you. Thank you, Mr. Shashin. One point I noted is the trust factor that has to be built in whatever communication that we build in social media or with any patient. And second is the mindset shift that you are talking. We are still looking at patient support programs as selling more pills. I just got hold of when you said this, that we are still looking at it as we have to sell more pills, so let's do a patient support program. I think that is the mindset that we need to change. Thank you for making that statement. Zena, over to you for the next question.
So my next question, I will ask Ashok sir to to give an answer to this. So Ashok sir, one of the common things that came out in the video was that stress, anxiety, depression can further aggravate your sugar levels. So what kind of strategies or what kind of tactics would you suggest that should be employed to tackle this huge but you can't be ignored kind of problem along with diabetes?
One of the things is, yes, stress does lead to hyperglycemia as such. Now, various type of stress can happen. What pharma industry can really do, or the healthcare industry can do to address this, is the stress after knowing or after being diagnosed as a diabetic patient. Because one of the things is that there are a lot of word of mouth which goes on. If it is a diabetes, it will damage the organs, you will become blind, you will have to go for dialysis, your kidneys will be affected, you might have to go for amputations. All these things keep on happening. So when the patient keeps on thinking about this, oh, I am a diabetic, I will have a multi-organ damage, I will have this, all these things, when it comes, it leads to further aggravating the glucose control rather than controlling the glucose levels. On the other hand, it also leads to other complications like hypertension and things like that. What we really need to do is to make the patient aware, not the Google, but make the patient aware in a more scientific way that, okay, you have diabetes, fine. You can control your sugar levels, and these are the ABCD things which you need to do. You need to take your medications on time and not leave it on the way. The second is, don't feel shy of taking medications when it is required to be. Maintain your diet, even in a social gathering. Prevent from taking too much of carbohydrate, or avoid sweets and things like that. That's what we can say. These are things which will keep your glucose levels under control, and you can delay or even avoid the complications of diabetes. These things to be. Now, how do you communicate this? It can be through the patient pack itself. So I know of a diabetes drug which was launched in India by a multinational company, and it gave all the tips of how to prevent diabetic foot and how to check the diabetic foot. Now, one of the questions which was there during the earlier panel was the digital stuff of it. Whatever said and done, I recently did a study for a multinational, a big multinational company on dosage adherence and things like that, and also another study on patient care, the digital care which we all talk of. So there were 3 types of reports which came. One was the aged population, and the aged population felt we must go to the doctor despite the digital stuff, because until and unless the doctor touches me, the doctor sees me, the doctor uses the BP instrument and the stetho, despite the fact there are home measurement services available, that section of the population, even learned, literate, highly placed professionals in the industry, they felt that same thing. The middle class also had a similar feeling of that. Now, when these are the real life studies which were made very recently post the pandemic, when digital became so much popular. And as Dr. Bansi Sabu rightly mentioned, some things can be tackled, but not everything. Everything cannot be tackled. A counseling, for example, cannot be tackled digitally. That is what he mentioned. And therefore, what I'm talking about is, if you want to lower the stress, spend time with the patient. The healthcare professional needs to counsel the patient. The doctor needs to comfort the patient. Follow these advices, follow your diet, follow your medication, adhere to the medications, do the exercise, change your lifestyle. And these are certain things which will help in reducing the stress of the patient, which is induced because of being a diabetic or being a hypertensive. Diabetic counselors need to explain that if we don't do these, the complications will come. So if we do, we can avoid complications. So let us not create a panic in the minds of the patients, but let us comfort the patient, speaking the science to them and explaining to them in a simple language. That is what the patient is looking for. Because when we saw the videos, the patients are talking about what healthcare industry or pharma industry can do is to communicate things in a simple way. Forget about the discovery R&D once a week or once a month and all those things. Forget about that part of it. But when we're concentrating on the stress part of it, at least what we can do is comfort the patients with a simple communication of the do's and don'ts and how things can be avoided in the future. I think that's my feeling about how do you reduce stress in the patients.
So your answer really strikes a personal chord with me. So just a small example of, 2 years back when I was diagnosed as a diabetic, most of the people in my family came and started talking to me as if this is the end. Matlab, there are people who hugged me, cried, said, "Ab to khatam ho gaya," and I had to counsel them instead, saying, "Boss, aisa nahi hai. It's not the end of the road for me. Please don't start crying for me." So there is a lot of. I agree with you absolutely, because I've been part of pharma. So kuch idea tha. Maybe if I would have not been exposed to pharma, I would have also cried and thought, it is the end now. Ab to pack up karo karke, types. So honestly, this strikes a personal chord. Your answer does strike a very personal chord with me. Thank you for that.
And also, the communication has to be not only with the patient, but also with the family of the patient who spends a lot of time, because they can also continuously counsel and keep the patient motivated and desist from, avoiding things which are not recommended. So the caregivers, the patient families and the patient, all of them need to be educated. There are only a couple of centers in India where it happens. I know of about 2-3 centers where it regularly happens. And there, we have seen records that patients have not got any organ damage even at the age of 102 and 103.
Wow.
And these are in South. I am not naming the center for confidentiality, but many people in the industry know that there are particularly 2 centers in the South where the maximum number of patient records are there. And these type of programs takes place, and there the incidence of organ damages are very, very low, and the complications are deferred for a long time. So I think that's what is required.
Wow. Thank you, sir. Thank you for that wonderful, answer and the suggestions along with it. Over to you, Swati.
Yeah, thanks. Thanks, Ashok sir. So yes, I think I named the campaign really well, sir. Is your spouse diabetic? So that creates a caregiver attitude. So let me ask the next question to Mr. Shashin. I'll take this. Vivek sir has asked me to ask this because he is considering the dental segment also being related with diabetics, because there are symptoms are related. There are markers which can be, I'll just put a stop in my video because connection issues are there at my end. I'll just ask the question. Am I audible?
Yes, Swati.
Yeah, thank you. So, Mr. Shashin, the question is, there's a correlation between good dental and oral health, and it can delay the pre-diabetic persons from becoming diabetic patients. If a person keeps a good oral health, it happens. Can you suggest the role of brand managers here? It is generally done by dental companies like Colgate and Hindustan Unilever, and it seems like their promotion. Even I myself being a dentist, I received such things from the site, but it actually hits as a promotion. But do you think pharma companies in anti-diabetic products can have a role to play in spreading the message of good oral health?
So, first and foremost, let me say the sweet tooth actually as a terminology which we use is more common in diabetes, which is known. Actually, I think the saliva also secretes sugar, actually, and that ensures that. But there are many misconceptions, and obviously, pharma brand managers have and it's a wide space. Let me put it. I tried to do a Google search in terms of understanding the collaboration in between pharma companies and say companies like Colgate-Palmolive in the world, and you find almost none existing. I tried to write questions on ChatGPT actually in various forms, and ChatGPT told me that there is none which is existing. Please, anything actually which will come in future, please, we will let you know. Okay, but there is nothing which is there. So it's a white space. Let me put it like that. So do pharma companies look at non-pharma companies and have partnered with them in many ways? Okay, so that's not unique today. That there are many examples of similar kind in the past. There are companies which have partnered with medical device companies. There are companies which have partnered with FMCG companies. One example which comes to my mind is, like you said, about Hindustan Unilever and a pharma company which was marketing doxycycline, which was with a neutral pH, unlike the acidic pH or Hyclate. Actually, they marketed, they partnered with Hindustan Lever and spreaded the message of Dove, which is a neutral soap, and there was free sampling of the soap given by the company actually to and the entire gynecology fraternity. Okay, so there are partnerships, and I think they work wonders. So this is a white space. It needs to be looked at. There is a huge opportunity when you look at what Dr. Bansi Sabu was speaking actually, and if you go back to his conversation on the recording, you will see that he has talked about a lot of patients coming from various specialties, but he didn't mention the dentist. Okay, when Ashok ji was talking about launching a product, a company talked about food ulcers and diabetic feet, where possibly it's a quick win, and there are many companies which have done that, but till no company has done anything about dentistry per se. Okay. And having said that, actually RSSDI and Colgate have a partnership actually for Colgate diabetes toothpaste. Okay, they have gone in, and it's
is there a net issue?
hygiene methods and so on. So it's an area which is a white space. I still believe that something which we can work on. If 50% of patient population in India is undiagnosed, and if there are 300,000 dentists in India, actually, obviously, if you're going to go to do awareness initiatives with other specialties like and other HCPs, why not the dentist, actually, which can harvest a large amount of undiagnosed patients who come with bleeding gums, who come with gingivitis and so on to the dentist, and can lead into a better patient outcome for even diabetes and the patient can be passed on to the specialist too. So I believe there is an opportunity actually, that there are not much examples which are there existing, and we can look at them going forward.
Thank you, Mr. Shashin. Yeah, a quick question, Zana, to Mr. Alhad, and then we'll move towards the next panel.
Sure. So one last question to you, Alhad.
Yeah.
How important is it to identify patient journey, and how can marketeers, pharma companies play a key role for better outcomes, in order to ensure better outcomes for the doctors as well as for the patients?
Yeah. Thanks, Jana, for this question. Now, patient centricity, one of the important aspects of patient centricity is going to be patient engagement. And when we are going to look at patient engagement, what is very relevant is their emotional status, because you cannot compel anybody to get engaged, right? So the first step of engagement starts by understanding the emotional status of the patient which he is in. And when you understand the emotional status which he is in, your communication is likely to create more impact, because it is going to get more into his gray matter, and therefore he is going to get charged. So what is the objective of patient centricity? It is to create patient activation for a particular action, and that activation will happen when he is engaged. And to get him engaged, we need to understand the emotions of the patient, and therefore understanding emotional journey of the patient would be essential for us to be specific in terms of our communication, because every stage of the patient will have different needs. So just to take you through, there is a beautiful Ross grief cycle, in which there's a patient journey given, that you have the denial phase, then there is an anger phase, then there is a bargaining phase, then there is a depression phase, and finally there is an acceptance phase. And what is important is that during the denial and anger phase, it is information and communication which is very important to the patient. Then during the bargaining phase and early depression phase, it is emotional support which is important. And during the acceptance phase, it is guidance and direction which is important. So once you understand this patient journey, the communication which you send to him will have more impact and more acceptance, and therefore understanding patient journey becomes very, very important. This is from the emotional angle. Also from clinical angle, there could be various types, understanding the clinical journey, which could help us classify and segment the patients so that we can plan actions which are patient-centered according to the phase they are in which. So when it comes to creating patient value through patient centricity, the patient value is increasing, or creating an important change in his life, or creating value for him. And this will happen when your communication and your activities which are patient-centered will be according to those phases and journey the patients are in which they are in which phase. Now, also what is important is you could look at individual communication, and you could also look at aggregated information when you do study of these patient journeys. So this is a short summary of how patient journeys could be important for pharma marketers.
Great. I remember seeing a very informative slide that you presented on day one of this event itself. So if pharma marketers are able to understand the patient journey, and especially the emotional part of patient journey, and then derive a communication out of that, then we have really hit the home run.
Yeah. Thanks.
Thank you, Mr. Alhad. Mr.
Thanks.
Sharik would like to speak something here related to dental and gynae. Sharik sir, if you can add.
Yeah, thank you so much. I just want to add something on what Mr. Shashin was sharing with the group. What pharma marketeers are doing since last couple of years. There is a rising trend which gynecologists are really appreciating and treating is dental hygiene during pregnancy, which is somehow also have a very minimal, but there is a relative percentage which can cause your miscarriage as well. So this is an emerging trend which is very well accepted by the gynecologists, and pharma companies are coming up with different kind of toothpaste to help those subjects to keep a dental hygiene during pregnancy before it get worsen and referred to the dentist. This kind of treatments are really appreciated, and the kind of work our Indian pharma marketeers are doing in this segment is definitely a remarkable and going to make some more changes in the goodwill of pregnant subjects. Thank you, Mr. Shashin. I was hearing you since your points were very relevant to gynae and diabetic both. So thank you so much for enlightening the group.
So thanks a lot, Mr. Khan. Actually, just wanted to add, you talked about a toothpaste. I have been personally privy to these conversations within my own friends and relatives. Actually, and when a toothpaste is launched, or maybe people talk about a diabetes toothpaste, actually people think about the fact that that you any which way are going to spit it out. Actually, what is it that is why do you need a sugar-free toothpaste? Okay, because there have been toothpastes in India which have been marketed which were sugar-free. Now the whole entire misconception is even added further by such communication. Okay, the fact that dental hygiene in a diabetes patient is more important from a perspective that he is more vulnerable. But the fact is that what we are going and communicating is that a sugar-free toothpaste is going to not increase the diabetes. Okay, which is okay. So I think I really believe it's a wide space, and we really can do a lot over here.
Thank you, Sharik sir and Shashin sir for throwing light around this subject particularly. There are a lot of comments coming and questions coming. Ashok sir, I'll ask this to you to just respond, not even answer. What the pharma community is vehemently saying that pharma can identify the doctor-patient disconnect to enhance adherence and treatment outcomes. Doctors need psychographic training programs, recordings of a doctor-patient consultation session, which can throw insights, and doctor can look on those, and they can also learn, and pharma can also learn from those recordings. What are your thoughts? Means pharma also needs to learn, but here the emphasis is that there should be a collaboration, a very strong collaboration between doctors and pharma, working together and doing the right things for the patients.
Yeah, I agree, Swati, because pharma alone cannot do anything directly for the patients. So it has to be done through the doctors. And I think a collaborative action between the doctors and the pharma industry and the healthcare industry in total, I would also include the hospitals, the pharmacies, everybody collaboratively within the healthcare system can ensure, deliver right messages to the patients, work towards betterment of the health for the patient, and ensure better outcomes. It has to be a collaborative effort. An entire healthcare industry has to be together. It cannot be just the doctors alone, or the dietitian alone, or the pharma company alone, or a hospital alone. No, all of them have to join hands together for a common cause of ensuring that we will ensure, for example, better patient dosage adherence, better patient outcomes, delaying the onset of complications, or minimizing the complications which are there. All these have to be done more collaboratively. For example, like what Shashin just mentioned about a sugar-free toothpaste. It's a wrong communication. It's just a selling of a brand. It's a gimmick, but it's a wrong communication. It doesn't do anything good for the patient. It doesn't do anything good for anybody. A toothpaste.
Right.
On the other hand, it's more of oral hygiene which needs to be communicated. All people should talk about the oral hygiene to prevent the cavities, to prevent gingivostomatitis, things like that, which can be even more common. And you being a dentist, you know much more than what we know, what can be the complications because of diabetes. And also, the dental setup can be one of the places from where the patient footfall can get into a diabetologist or a physician to treat that. Because when you examine the oral part of it, because of certain things that you see, you might feel, it may be a primary feeling that the patient must be suffering from high sugar level or something. Let's get it tested. So when you get the blood tested and all, when it comes, you can lead the patient to the physician or the diabetologist. So I personally feel it's a collaborative act which can ensure better patient outcomes.
Thank you. Thank you, Ashok sir, for supporting this thought that is currently trending in our comment box. Vivek sir, you want to add something?
Yeah, Sachin a little bit earlier talked about the patient spitting out the toothpaste. But I can tell you there are certain medicated toothpaste which dentists say they should not spit out. Second, some very simple hygiene measures like brushing your teeth twice a day. That again is never followed. And even I did not do that till I got my first tooth extracted. So these are some of the simple things which pharma companies can do. That's all.
So I see a need of lot of awareness. See, we are discussing within few hundred people here, but what about the public? They are completely in dark that what is the actuality, where is the trust, what statement they should trust and which statement they should not trust. I would thank the panel here for doing the discussions on diabetes videos and enlightening the audience on how this inciting has to be done, where all the patient pain points lie in his or her journey. Thank you, Ashok sir. Thank you, Shashin sir. And thank you, Mr. Alhad, for joining us today. Let us
Thank
move
you. Thank you.
towards the next.
Thanks.
Thank you.